So let's think like the brain, okay? You have an injury into, say, I don't know, trapezius or levator scapular muscle, yeah? Right. The major role of the brain then is to protect. So what can you do to protect? Contract, yeah? So does disregard to the problem, the brain feel there is a problem and send an impulse to contract, for the muscle to contract. Now, either the problem's gone or reduced, but still the brain is not sure whether it can let go. This contraction can stay for a long time. It can actually stay forever, if you think, if the person is not awarely decide to challenge it. And there are some people, their personality and their brain personality is, if in doubt, don't try. Maybe it's painful, the pain can be psychosomatic, and there start being a kind of avalanche of problem that actually start for something small, however develop to be quite big. For example, I have a client with fracture, and now she can't lift the hand anymore because she was so afraid of moving everything that now she can't move the arm above, say, 70 degrees here. So not even getting to 90 degrees. It's quite common. Yeah, so to avoid that, first you need to know when to start the treatment, not in the acute, but when it starts to be mild. And also, let's look at this technique now, okay? So let's say that the muscle is protected, yeah? So it is, the upper trapezius and levator scapula is contracting, okay? So I wouldn't say contracting, maybe there is a higher tone and they feel on guard, okay? So what you usually would go and say, okay, let me stretch it. Yeah. But remember, who do you talk to? You're talking to a protective brain who doesn't want to let go. And you know what? If someone comes and you don't want to do something and they force you to do something, you're more likely to say, no, I don't want. So that's what happened to the brain. So instead of that, what you can do is actually counter the strain. If the strain is to protect, to take the muscle into contraction, what you're trying to do is actually increase it. Yeah? Now, when you increase it, you create laxity in the muscle. Yeah? So there are two ways to look at. First of all is to hold it in this position. Just to hold it, and that's it. I think that is a bit of a miss, because if you're there, why don't you show the muscle how wonderful life could be? Yeah? And exactly that's what you want to do. You want to really talk to the muscle and say, okay, let me see how, I can show you how you can be more relaxed. So, but you're still in a position of laxity, a position of release. Because now when you put the muscle in a laxity, just to start with, you're relaxing it further. Okay? So it's actually two techniques together. Positional release, and then you start slightly massaging it. Now, when you're massaging this muscle, you're on a very dangerous position. If you do too much, the muscle would say, I told you, he's dangerous, leave. And then you are not back to square one, you're back to even worse, because the muscle now is more apprehensive. So you have to be very careful with the way that you persuade the muscle to relax, to let go. If you do too much, you back square zero, even more, okay? So, very attentive, look, do little bit. And like everything, you build on what you've just done, which means if you see that it's okay, add a little bit more until you get into the therapeutic zone. What is the therapeutic zone? Is where your pressure and your manipulation of the muscle is give the best relief. If you do too much, is not any good. If you do too little, you're not in the therapeutic zone. And a therapeutic zone is really the depth.
So is that, would you consider that palpation with your
No,
fingers?
now I'm actually doing a local petrissage, feeder kneading in a positional release way. Yeah? So that's really the simplest way you can do. You can add to it by actually maybe confusing the muscles more. If you do that position, you see actually I'm doing the same. What do I mean? The upper trapezius is in the same position, but the brain thinks, stretching the arm. Okay? And here now, after they get used to, then you can try to do the same and see if there is any better way. And now, how do you know if it's better if there is no, if the muscle is not contracting or restricting? If the muscle really relaxing and going nicely with you, you know that you're all right.
Can I ask a question? Could you do this technique with the shoulder with someone who has bursitis?
It depends. If it's not allowing you, you can't. So it's actually, it's not much the pathology, is more what the body allows you at that time.
As if it's someone who can't, again, they're guarding, they can't,
Yeah.
how she's guarding, she can't lift her arm.
So let's say someone's
Because of the
guarding,
guarding.
then what you're trying to do is to put it, to get into the end of the comfortable zone, and then start to do it.
Okay.
Yeah. And then try, maybe after a while they can do a little bit more.
And then future
It is the
treatments.
question whether the guard is still reasoned. There is still a reason for the guard. Don't mess about with the guard. The guard is good. If there is a reason to that, leave it.
So go within the range.
Go with it
Yeah.
and maintain it in the range. Don't try to be too smart too quickly to say, okay, there is a problem here. If you want to say something, if you do want to do something for the bursitis, that might be different. Maybe you can do other things, but with the guarded contraction, leave it for a little while. Okay? Okay. Let's take another example of a. Let's take. Yes.
Would this technique apply to like frozen shoulder?
Right.
So
So pretty much the same thing.
Oh, well,
Yeah.
I'm thinking when they can't move it anywhere, where it just it's frozen, you know?
Right.
So they don't, it doesn't move. Yeah. It's able to move it to keep to be more contracted.
Yeah, then you can try that. Frozen shoulder is a little bit different than bursitis, in which there is just a buildup of collagen fiber into the joint capsule. So then moving and freeing it might be working. If you have a more inflammation, maybe not. Maybe you
Mine
wait
was
for the
just-
inflammation to let go.
My
Okay.
client actually came from frozen shoulder to bursitis.
It could be.
Very interesting.
Let's take another muscle, quite different, and that would be the quadratus lumborum. Okay? So in quadratus lumborum, I'll just reflect that this way. Okay? So you are I'm taking the spinal muscle because they are quite different in the position and orientation. So if you palpate the quadratus lumborum, so you're looking for the erectus spinae, and then you go a bit further, and let's say that you feel that muscle is tight, and when you're pressing on that muscle is quite tender as well, which is very common for back pain. Not all the time, but common. Now, any idea how can I put this muscle into laxity?
Contract. Squish.
Contract what?
Taking the shoulder and the hip like that.
Okay, so you can take the shoulder and the hip, yes, definitely. Yeah, you can do that.
And then you can't do anything.
You can do it in one. You can actually lift, hike the hip closer to the ribs. Do you see what happened? If I do that, my thumb sinks. So that means that this muscle, right? bit? Or? No, okay. So, you're starting by palpating it. A lot of it is actually the sensation rather than a circus, beautiful, amazing technique that you kind of do it like, you know, special. So it's a lot of it is very, for the camera it's probably just boring because you can't see much. But what you need to do is more feel, and it is a communication. It is really a conversation you have with the muscle. Little bit, a little give, a little more. And that's the story that you're telling this muscle. And if you start moving yourself in a unpredictable way, the muscle would not trust you. So you have to be quite calm within yourself and do that while you're doing it, yeah? So putting that, and then every time I push the hip up, I lax the muscle, and then if you want, you can even stretch it a little bit, but maybe it's too early. Maybe you just work with laxity. You can do it this way, you can do it with a full wrist.
So would that be the case, your first treatment with a client, you're doing sort of gentle like that, and subsequent appointment they come to see you, and then you maybe...
You have to work with what the symptoms are. So in a way, sometimes what the pathology is does not really matter much. What matters is the symptoms that they have, and you're working with the symptoms. So here, so you need to push on the greater trochanter of the femur. So I can try to do more. And then maybe see if you can do the opposite. Right?
Joe, you mentioned
Later on, just let me finish. Later on, you can maybe just hold the muscle here and then kind of lift it this way and then down, and then this way and down while you're helping with the hip. So here, for example, you look at the spinous processes of the spine underneath, and then you lift it up while pushing the hip onto the other side. You see, I create more space, and then back. So you're trying to take the muscle out of its comfort zone, slowly, every time a little bit more. And how do you know how much is too much? Because if you are in the therapeutic zone, if you go above that, it's going to be too painful. If you're right there, they feel something, and if you're off, you're not enough, it will be, just feel nice, or, Should we do these two muscles? Yeah? Question. What's the question?
You mentioned... Please.